Hi, I'm not sure I'm turned on, but I'm going to get it started. And yeah, I think it is turned on. Okay, this is Dr. Stowell again, and I want to welcome you to the second resource to help you develop the skills needed to acquire the knowledge and the attitudes that you're going to need to become an RN. You are going to need those special techniques, those special study techniques, because nursing content is complex, nursing tests are complex, nursing practice is complex, and nursing school must teach you how to think like a nurse. Now, up here, if you see that you are studying but not learning, that is, not getting the grades you want, well, it is time to change the way you study. So let's look at some very common ways to study. Now, what we have over here are very general strategies that most everybody, I would venture to say, who is in nursing school right now have used these in the past for nursing courses or other courses. They are passive things. You outline the chapter, you organize the notes, you record or re-listen to the lecture, and then you go over them and over them and over them. Well, it's rather passive. And it doesn't really capture what you need to know. So we have on the other side here some very specific strategies for nursing. They're active learning strategies. Now, they are not unique to nursing. They can be used in other courses, other professions, and so forth. But, excuse me, here's how we do them. First of all, you read the material before class. Ha ha ha, lots of luck. But anyway, I'll show you how to read it quickly. Then you're going to take notes in class. You're going to review your notes after class. And then you're going to read the chapter after class. But the biggie is you're going to get to know your textbook. And the textbook, your nursing textbook, is your new best friend. So let me introduce you to two textbooks we use here in the ADN program. The reason why I'm using these two books as examples is because of the way they are formatted. They have some similarities, but they are different. And the way these textbooks are designed, they are designed to make it easier for you to learn the material. So let's look at the different types of formats and how you can use them. In the mental health textbook, on page 1 of every chapter, you will find this material and the introduction. All of that on one page. So anyway, what is a core concept? These are concepts, maybe 1 or 2 per chapter, sometimes 5, 6, or 8. But these are very important concepts that the student must know to be able to understand mental illness effectively, understand the care of mentally ill clients. Now, there's a chapter outline. Well, that's good, because what it does is give you a heads up on what you're going to be looking at, what you're going to be learning in this chapter. And that's very important, because chances are you know diddly squat about most of the material in the chapter. So by telling you what's coming ahead, it kind of prepares your mind to be focused on what you're going to hear later. Key terms. That's going to be very important, because if you don't understand these terms, if you don't know what they mean, you really won't know the material. Then there's the objectives. Now, the objectives are another one of your best friends, because students always say, well, I don't know what to study. I don't know what's going to be on the test. Well, I can tell you what's going to be on the test. The objectives are going to be on the test. Now, they are not going to look exactly like what how they were worded in the objectives, but the content that the objectives are referring to, that content will be on the test. One of the interesting ways of using the objectives to study is they're often stated in a sentence format, in a declarative sentence. I don't have a copy of the book here with me, so I can't just say one to you. But what you need to do is take the objective, because it's a statement, turn it into a question. And then as you read the rest of the chapter, try to answer that question. Get the material that's going to answer that question. Now, we're still in the mental health book. That book gives a homework assignment right there on the first page. And it has a little bit of case studies or questions that pertain to the content that you're going to be dealing with in that chapter. And so it's to get you thinking, and since it is a homework assignment, by reading the chapter and then coming back and trying to answer that homework assignment, that will help you to have the material stick in your mind, because you will be interacting with it. Well, after all those things come, now we're still on the first page, then comes the introduction. Now, the introduction is very good because it tells you what the chapters are going to be about. Then, after the introduction, the rest of the pages have the content. But look at this. At the end of the chapter, there's a summary and a list of, I don't know why my cursor keeps running away, a summary and key points. Well, guess what? It's going to be easier for you when you start to deal with this textbook if you start at the summary and the key points, start at the end. And the reason start at the summary and start at the key points, because again, that will tell you what the chapter is about. So now you have a beginning understanding of what material you're going to be dealing with. And if you have that understanding, then the material that is in the book is not going to be totally foreign to you. Okay, so let's review. If you have a mental health textbook or any other textbook that has a summary and key points at the end of the chapter, start reading there. And then go back to the first page of the chapter. Because now that you know what the chapter is all about, then those core concepts are going to say, oh, okay, I remember reading about that in the summary. The chapter outline that's coming next, again, we're just scanning the book. The chapter outline that comes next will show you how the material that was summarized will be dealt with and in what order. Now here we go with the key terms. The key terms are the key terms, words, or concept. Well, the words are really words that are going to be very important for you to learn. And then the objectives. The objectives and the key terms and the core concepts are really what you should be expected to know after you have finished reading the chapter. Now remember, this is just an overview that we're doing to see what the chapter is all about. This homework assignment on that, in this particular book, you save till you've read the chapter. And then you go to the introduction and then read your subsequent pages. And then when you get to the end, you can look at the summary again, look at the key points that were mentioned in the chapter, and then you take the review questions. Now, what I have just done was to show you how the book is set up, what all those things mean. I have suggested and advised that when you are doing some pre-reading before class, because we always want you to come into class, quote, prepared. And by prepared, we really mean having an idea of what we're going to be talking about, because it's just a waste of your time, really. Maybe it's not a waste of your time, but you're not using your time effectively in class if you haven't come prepared. So you do this ahead of time. It's just real quick, just to look at that. And then when you actually start to, when you go to class, then you're going to take the notes. And the notes and the things that teachers are saying are going to begin to make some sense. So now, when the class is over, you want to review your notes, and when you get time, you're going to go back and read the chapter in its totality, and then take the test questions as a review. Okay. Now, let's look at an adult health textbook. They're different. They do have learning outcomes, which is what you're supposed to learn, what you're supposed to be able to be tested on when you finish the chapter. There's going to have key terms. That's other testable material. And then there's content about the various health problems that people have. And then at the end of the chapters, of each chapter, then there's a set of questions called Bridge to NCLEX exam. And the interesting thing about the questions in this textbook is each question is correlated with a number, with a specific number of a learning outcome from page 1. So this is going to be a test to see if you really learn what you were supposed to learn. Very good, very good. So, since this textbook is different than that one, in the sense of the way it's formatted, prior to going to class, an adult health class, I suggest that you look at the learning outcomes, you read them, you read the key terms, so that they won't be unfamiliar to you when you go to class. So then, when you're finished with class, then what you do is come back and actually read the content in depth. Now, whether you're in a mental health class, whether you're in an adult health class, it doesn't matter, or any other PD, OB, whatever. Some things that you could also do during class. You could have on your notebook, the page on the left, you're going to take notes from the class. The page on the right is going to be material that you want to really check on later. Because if the teacher said, was talking about O2, CO2 exchange or cardiac arrhythmias, and there were some things on those topics you weren't clear about. So on the right-hand page, you just write a little note, check on O2, CO2 exchange, check on cardiac arrhythmias. These were the things that I didn't understand. Okay, so this is what you're doing in class. Then, also, you can ask questions in class. You just identified that you're not so sure about O2, CO2 exchange, whatever she was talking about, and certainly not the cardiac arrhythmias. So ask a question. Chances are other students have the same kind of question, and the teacher can answer it right there. Okay, now going on to something else. Yeah. I talked about notes. Lots of different ways to take notes. Some people do outline the chapter, but really that's not very helpful when it comes to nursing. You really need to use content-focused notes. And here are three types of content-focused note forms. This one, the latte, you probably use already. And what goes up here is the name of the disease and what it does to the body. Name of the disease and what it does to the body. L is for, which says, how will your patient look? Well, that's another way of saying signs and symptoms. A, assessment techniques. What techniques are you going to use to assess the problems that this person might have if they have this disease? T, what tests will be ordered for a person with this disease? And then the other T is, what are the treatments that this patient will receive if they have this disease? And that's the medical treatments and the nursing treatments. And then the final one is E, education. What kind of education, facts, information will you be giving to the family and the patient? And you see how focused all this is? It's very specific categories. And these categories are going to be the source of all the test questions that you will ever find. Another way to organize your notes is what I call nursing process notes. What are the signs and symptoms of the disease you're studying? Very similar to this, what's over here and there. What are your nursing interventions? What are your medical interventions for that disease? And what are the patient medications? And I did not put that here, I forgot, but it should be education again. What are you going to do for patient and family education? Now, I said medications because you really have to know about medications. So to focus your whoops. Oh, I'm sorry. Let me go back. Okay. To focus your learning for the medications, you want to use drug cards. And I think your professors are still doing that. And on the drug card, you want the name of the drug, its use, its actions, the standard dose, the side effects, and any drug-drug food interactions. Well, it's important for you to realize that you need to study to learn the material, and you review for the test. This is important because there's two different processes that are used. To study, you're going to use the technique that I showed you about how you read the textbook, how you work with the textbook, and how to fill out these special nursing content focus notes. Now, to review for the test, you're going to do something different. Ideally, you should be studying in groups. And when you're studying in groups, you can quiz each other. You can explain the signs and symptoms of the disease. You can explain the nursing interventions. You can explain the drugs. You can explain the rationales for why the nursing interventions are what they are. Why are the medical interventions being done? Why is this particular drug being used? And you can, when you work in a group, you can clarify your understanding of things. So that'll keep you very busy, but it will keep you active and focused. Now that was a very short review, but I think it will be helpful for you. So my wish for you is to be well, study smarter, not harder, which we have just reviewed some ways to do that. And I want you to achieve good things. Your nursing license. Have a good day.